This week on the Frontiers of Medicine. Alzheimer's disease, Part 2. With America and the world hurtling towards a healthcare crisis, what are the possible causes and potential cures for Alzheimer's? If you have Alzheimer's, what are your options? And if you're caring for an Alzheimer's patient, how do you cope? Alzheimer's disease, from A to Z, on the Frontiers of Medicine. Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology. Now, here's your host, Dr. Louis Sullivan.
Welcome to Frontiers of Medicine. Alzheimer's disease. More than 4 million Americans have it, and it's believed that at least twice that many will have it by the year 2020.
Last week on the Frontiers of Medicine, we learned that Alzheimer's disease is a progressive neurological disorder that afflicts 4 million Americans and costs society $100 billion a year. In the next 5 decades, those numbers could quadruple.
Who is that? Huh? It's you? And me?
The disease is marked by loss of memory, confusion, and inability to complete simple tasks, and, in some cases, marked personality changes. If a patient lives long enough, he will eventually forget how to eat and breathe, and will die from the disease. Just under half of all Americans over the age of 80 suffer from Alzheimer's-related dementia. Although it is not just a disease of the old, some experts think that 40% of all 20 and 30-year-olds have the beginnings of Alzheimer's in their brains. The symptoms have just not made themselves known yet.
The ticking time bomb is a good metaphor for Alzheimer's disease. The question is, when does the time bomb start ticking? Recent evidence shows that it can start as early as people in their 20s and 30s. And perhaps majority of them have started many years before we can detect it.
Scientists have not been able to pinpoint exactly what causes the disease. But they do know that the brains of Alzheimer's patients contain characteristic plaques and tangles that contribute to the loss of neurons in the part of the brain that controls learning and memory. And they know that a number of factors may contribute to that process. There is already evidence of a genetic link for early onset Alzheimer's disease that gallops through a relatively small number of families. And it is thought that at least 2 genes contribute to the development of Alzheimer's after age 65. But not all cases of the disease have the same root cause. Some scientists believe there are certain triggers that may also contribute to the onset of Alzheimer's. These triggers range from bacterial or viral to environmental toxins, to brain inflammation, and even diet and exercise. But regardless of the cause, if doctors were able to diagnose Alzheimer's early, they might be able to prescribe drugs that would delay its onset for months or even years. Unfortunately, diagnosis is still an inexact science.
Because really, until you do an autopsy, you cannot definitively diagnose a dementia. You can lean in one direction or another based on the constellation of symptoms, and that helps, especially if there are drugs that you want to try, but you can never be 100% sure about your diagnosis.
Doctors mostly diagnose Alzheimer's by excluding all other possible reasons for dementia. Autopsies remain the most foolproof way to see whether a patient has the characteristic plaques and tangles of the disease. But diagnosis of the living has remained more difficult.
Russell, I'm going to show you 4 cards. Each card will have 4 items on it.
Up till now, doctors tested for the cognitive impairment indicative of Alzheimer's using various drawing and memory tests. But now Dr. Ronald Peterson of the Mayo Clinic has codified those tests and others to give doctors a more comprehensive and accurate way to test for Alzheimer's. It's called the Mild Cognitive Impairment, or MCI test. The goal is to catch patients at earlier stages of development and plan a course of action to delay the onset.
The implication of this study for Alzheimer's disease research is that it identifies a group of persons who are at increased risk for developing the disease. This may have implications for treatments in the future. This is the group of individuals in whom we would like to intervene with an effective treatment in an attempt to prevent their subsequent development of Alzheimer's disease.
The guesswork would be taken out of Alzheimer's diagnosis if there were a simple blood or urine test to look for a biomarker of the disease. Researchers have made some progress in this goal, though the scientific community remains skeptical of tests developed so far. Genetics tests for some kinds of predisposition to Alzheimer's are also available. But because treatment is still hit or miss, there are ethical considerations about predicting an individual's chance of getting the disease when there's not much to be done about it.
Because these tests really only identify risk, they don't say you will get the disease, they simply say you have a higher risk of getting the disease. That information is sometimes not particularly beneficial to the individual.
Despite the uncertainties of diagnosis, there have been some significant developments in Alzheimer's research. The School Sisters of Notre Dame are part of a large and unique study that is contributing enormously to the understanding of the disease. Because their lives have been so well documented, researchers have found a link between the ability to communicate and Alzheimer's detection. By analyzing the schoolgirl writing styles of 25 nuns who have since grown old and died, they found that those whose writing contained the lowest density of ideas per paragraph were the most likely to develop the disease later in life. And scientists at New York University and elsewhere have made great strides with brain scanning and imaging technology, allowing them to detect the structural and chemical changes that signal Alzheimer's. These breakthroughs may one day lead to a productive understanding of the disease.
Although Alzheimer's disease is primarily a mental and physical disease, its emotional impact is enormous. It can tear families apart, and it can leave loved ones exhausted and despondent.
While doctors still have no foolproof way to diagnose Alzheimer's disease, patients and their families often suspect something is awry. Barbara Pilgrim is the executive director of the Western Maryland chapter of the Alzheimer's Association. Often, she is the first professional patients in that area talk to when they suspect they have Alzheimer's.
Often when people who think they're in the early stages of Alzheimer's disease call us, they call and say things like, "I'm living my life as though I'm always walking into the theater in the middle of the movie. Something's out of kilter, they're not sure what. They know the problems are more serious than just age-associated memory impairment, but they don't know quite how ominous they may be, and they want to find out."
Paul Lebo led an active personal life and loved his job as an ambulance technician. He talks about being diagnosed with Alzheimer's 2 years ago at the age of 53.
I'm sure there would have been some really bad days and being very upset. And that went for quite a while, perhaps 6 months, of not knowing what was happening and what to do after, working all my life and doing this stuff. And somewhere there was a transition. And I realized, I've been reading about it, and obviously it's not going to go away tomorrow or next month, and decided that I would continue with my life and do what I want to do.
Anita Heimson also has Alzheimer's disease.
I don't feel as though I am ill. I don't know anything about it, and I do everything I have to without any trouble. It came as a shock to be heard, "You're an Alzheimer." And what the hell is an Alzheimer? Never heard of it. But it's not that bad.
We're newlyweds, so to speak. We've only been married 15 years. It's our second marriage. And it was a tremendous change for the better for me when I met Anita and got married. And it was very joyous. I was almost a 22-year-old again for the first time. And then to become aware of losing her, we've certainly lost a tremendous amount. Thank God she doesn't realize how much is gone, but she's a very small shallow of what she used to be, from vivacity to enjoyment, the joy de vivre. I've never met anybody that had more joy de vivre than she does. She still has that, thank God. And she still enjoys doing whatever is suggested that we do. She can't remember it. You ask her where she was traveling. We just came back from a 3-week trip yesterday, and she can't remember it. But we certainly have a good time when we go.
I don't have anything in yellow.
As difficult as Alzheimer's disease can be for those who have it, it can be even more devastating for the people who provide care for the patient, for the people who are forced to watch once vibrant lives fade away, helpless witnesses as a loved one becomes unrecognizable.
Caring for someone with Alzheimer's disease is actually more difficult than caring for a child. With a child, although in their infancy there may be dependency needs, that child will eventually become more independent and more rational and more reasonable. You don't see that progression with people who have Alzheimer's disease.
In fact, just the opposite is usually true. Alzheimer's patients become more dependent and less reasonable and rational with each passing day. That can be a heavy burden for spouses who also are advanced in years and have medical problems of their own.
I love you, Mother. I love you, Joan.
The stress of caring for a family member with a chronic degenerative condition like Alzheimer's can really throw the entire family into turmoil because there are so many things going on. Everybody's dealing with it in their own way. There are other issues going on in the family. You know, regular life does not stop.
Give me that, Grandmommy.
Even if the caregiver is a child of the patient, that can present problems of its own. In that case, the caregiver is often caught between providing for the needs of their own family and a parent at the same time. Peggy Davis's mother had Alzheimer's disease for more than a dozen years before she died.
I withdrew along with her socially. I became very, very quietly angry, and I went through the depression that pretty much she was going through. It's a great misnomer that Alzheimer's patients are the only victims within this disease, because anybody who loves an Alzheimer's patient, anybody who cares for an Alzheimer's patient tends to suffer somewhat of the same symptoms, becomes the victim also.
Besides the stress and fatigue that are brought on by the day-to-day care of an Alzheimer's patient, there are the stressors that are caused by watching once vital people fade away. Jim Hooper was the vice president and treasurer of a college. Several years after his retirement, he was diagnosed with Alzheimer's disease.
The thing that was hardest on, I think, were the grandchildren. They, I'm afraid, will remember him more or less the way he was at the end, when he was so devoted to them through the rest of their life. I hate to think that at the end that, you know, they've thought of him that way, but we'll hope they'll remember the good times.
There is no cure yet for Alzheimer's disease, but there are many promising treatments on the horizon.
As of now, the FDA has only approved a small number of drugs for the treatment of Alzheimer's disease. One such drug is Aricept. Manufactured by Pfizer, Aricept has improved the cognitive ability of many patients, and more than 500,000 Americans have taken it for treatment of the disease. Cognex is a similar, newer drug produced by Park Davis, and it has shown an ability to slow cognitive deterioration, although some medical professionals are concerned about its heavy side effects. And patients outside the United States have another option, the drug Exelon, made by the Swiss company Novartis also works to improve the cognitive ability of Alzheimer's patients. But there are pluses and minuses to these drugs. While they allow patients with mild and moderate Alzheimer's to continue performing daily tasks for a longer period, they only serve to mask the symptoms of the disease. They cannot stop its progression or treat the underlying causes. And there is anecdotal evidence that these drugs only mask the symptoms successfully for about 6 months.
Over time, as someone's Alzheimer's disease progresses, there really is no medication that addresses the underlying disease. Medications, when they're used, are to help with some of the behavioral problems that can occur in Alzheimer's disease.
7294316. I'm quick.
You are so quick.
That points to one of the fundamental challenges that doctors face in treating Alzheimer's disease. It's usually diagnosed after symptoms become noticeable. But evidence suggests that Alzheimer's can begin its deadly progression years, perhaps decades, before that point.
We know from the pathology, from study of accident victims, driving accident victims, that individuals as young as 30 and 40 years of age will begin to show evidence for neurofibrillary tangles, the lesions of Alzheimer's disease, in the entorhinal cortex.
By the time Alzheimer's symptoms become apparent, the damage to the brain is too severe to be reversed by currently available treatments.
Can you tell me what day of the week it is?
The answer, say experts, is for the medical community to become proficient at diagnosing Alzheimer's disease early. That would allow patients to begin a course of prevention and treatment before the disease becomes debilitating. It's estimated that by slowing the progression of Alzheimer's disease for 5 years, doctors would cut the number of patients with symptoms in half.
If we thought about the best possible outcome, we would probably test people who might be in their 30s, 40s, 50s. If we think about something like the PSA antigen tests that are out there now, you might start giving that to people as their risk begins to rise.
Preferably, one would want to have the dementia set in an hour before they die, or if an hour is not possible, the day before. If that's not possible, maybe 10 days before, or if not, a year before. But clearly, we cannot afford to have a society whose population, 40 to 50% in their 80s, have dementia and are going to be demented or disabled for 20 to 30 years.
In addition to improving diagnosis, researchers are working fervently on new treatment methods. Many other disease therapies are discovered through animal testing, but researchers face a natural roadblock when it comes to animal experimentation for Alzheimer's. No animal species has a human's advanced ability to think and reason, nor do animals appear to suffer from the exact equivalent of Alzheimer's.
Yeah.
Despite their limitations, these mice represent one of the few animal models researchers are using to test drugs for the treatment of Alzheimer's disease.
So this is one of the black mice that also has the Alzheimer's genes in it.
They're called transgenic mice. That is, they've been implanted with 2 of the 3 mutant genes known to cause Alzheimer's in humans. A mouse with Alzheimer's symptoms, when introduced into this maze, will show signs of memory loss by forgetting which tunnel he just exited. These mice will eventually develop pathological signs of the disease at an accelerated rate, giving researchers a living model in which to test new drug therapies. Dr. David Morgan is the director of the Alzheimer's Research Laboratory at the University of South Florida.
What we would like to see is a drug that, when we treat them for this 2-month period, ends up with no plaques. That, when we do that, that's when I think we'll have a very effective drug.
Even still, there are promising therapies on the horizon. One of the potential treatments is a substance that is found naturally in the body, estrogen. Ruth Molnard of the University of California, Irvine, is studying the impact of estrogen on women for the treatment of Alzheimer's.
We were looking at a couple of things. One is, can
estrogen, when given to these women, help improve their cognitive abilities and their functional abilities? And then secondly, can it delay the progression? If it doesn't stop the disease in its tracks, can it improve function, and can it maybe make the disease progress at a slower rate?
The results of the study won't be available for several more months. But another study done at Columbia University in New York showed that postmenopausal women who took estrogen had as much as a 40% lower risk of developing Alzheimer's disease. Some pharmaceutical companies have taken up the challenge of developing estrogen-like compounds without the side effects for men who can't take estrogen and women who shouldn't. And if you are at increased risk for the disease, there are other substances that are available now that may slow the progression, although they should only be used after consulting your physician. The first is vitamin E, an antioxidant. Antioxidants are thought to limit damage caused to brain molecules by free radicals, the same highly destructive oxygen molecules that are thought to play a role in cardiovascular disease. A 1997 study at the University of California, Irvine showed that increasing the intake of vitamin E delayed the progression of Alzheimer's disease for months. Another possible way to control the advancement of Alzheimer's is to prevent brain inflammation.
Things that normally in a young person would not cause inflammation will cause that in an old person. And your brain doesn't have any pain receptors, and so inflammation doesn't hurt in your brain like it does in your joint. You don't take an aspirin and things can get out of control. In fact, we think that that's one of the reasons that Alzheimer's occurs primarily in old people, is that their brains have an inflammatory reaction to the amyloid when it's formed.
You look at twin pairs in which one member has Alzheimer's disease and the other doesn't. Lo and behold, it turned out that the one who did not have Alzheimer's was more likely to be taking, for other reasons, a non-steroidal anti-inflammatory medication like Motrin or Naproxen that's used for a variety of arthritic conditions. So then if you give a medication which combats the inflammatory process, you might undo some of the damage or prevent further damage from the plaques and tangles.
A man-made drug that helps heal broken bones has been shown to help rats regain lost movement in their limbs after a stroke. Scientists think that the drug, a growth protein, may help the brain rewire connections around damaged brain cells. And doctors also think that drugs used to treat epilepsy patients can decrease the aggression and agitation that Alzheimer's patients suffer. Even light therapy has been shown to help patients sleep better and reduce agitation. Another area that has shown promise in helping treat Alzheimer's is, believe it or not, nicotine-like compounds. While doctors stress that no one should begin smoking or use nicotine patches to treat or prevent the disease, research on rats has shown that nicotine-like compounds can improve memory by stimulating receptors for acetylcholine, a crucial nerve signaling chemical. Several companies, including R.J. Reynolds and Johnson & Johnson, are working on developing a nicotine-like therapy without the side effects. Alzheimer's disease. It's likely caused by multiple factors, and its cure may eventually take multiple forms. Until that day comes, Alzheimer's patients and their families should take each day as it comes and take the opportunity to say, I love you.
I know my mother. There's days when she's aware totally what's going on around her. And those days are the days that I value because I can tell her that I love her and I know it gets in there. And on a really good day, she tells me it back.
For more information about Alzheimer's disease, visit our website at www.frontiersofmedicine.com or call our Alzheimer's helpline at 703-243-7942, extension 100. Next week on Frontiers of Medicine. Prostate cancer. It's the second leading cause of cancer-related deaths in American males. But aggressive new treatments may lower the statistic and improve quality of life. Ultrasound not only does this, It also does this: remove unwanted fat, and with less pain and shorter recovery time. New results are in, and the news is encouraging. An update on a new procedure that's helping patients beat the bad back blues.
Thanks for watching. We'll see you next week on The Frontiers of Medicine.
Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology. To purchase a copy of Program 120 Frontiers of Medicine, please call 1-800-553-7752 or write SCE TV Marketing, Box 11,000, Columbia, South Carolina 29211. Major credit cards accepted.